Hey guys, thank you for joining us today. Welcome to Film, Food, and Fashion Are My Passion, and I'm your host, Angeliki Nakos. Today is a very special episode. We are sponsored today by Young Medical Spa, located in Lansdale, PA. They actually have 3 locations. So I'm here today in the Lansdale location with Dr. Young. Welcome to the show, Dr. Young.
Thank you.
So guys, like I said, this is a special episode, and I want to talk about, what we're going to be doing here today. I'm turning 50 in about a month. As you guys all know, everybody who follows me on the Philly Food Fanatic knows that I'm going to be turning 50 next month, and I feel like I need a little bit of a face lift or tune-up, so to speak. Not anything too crazy, but at the same time, I do want to get rid of some of the things that are, come with the with aging. Yeah, and the fact that I am on camera all the time, and I have so many followers. We're at over 500,000 followers.
That's very good.
Thank you very much. It's a huge accomplishment for us. And guys, our analytics are really good. We are mostly Philadelphia, New Jersey, and New York. So the followers are your actual potential customers.
Good.
We're not like all over Europe and stuff like that. We are here local. So thank you guys all for following us and watching us and, sharing and liking all of our content. So today we are going to talk about me. It's all about me today. And Dr. Young, what can we do? So this is what I have in mind here. I have my eyelids are starting to droop here. And I do have a lot of this going on here. This is coming, I've been noticing with the aging. My lips need a little bit of a pop because I feel like when I am on camera, I have to wear a lot of lipstick to make it look, like they're popping, and I'm tired of putting on so much lipstick. So that's one of my concerns. And then the other concern I have is a lot of the roughness that comes with the aging, like the
skin texture.
Yes.
Yes.
So what do you recommend for me?
So we kind of started with what brings you into the office today. We kind of blended that with your opening statement. So we're going to talk about some of the things we can do to address your issues. So usually when I'm doing this, I have the patient look in the mirror.
Yeah,
all right?
I have it right here, guys.
Yes, which may get, if it gets in the way of what you guys are doing for that stuff. So the upper eyelids that she mentioned right off the top of the bed, it's tough really to tighten those. There are some non-invasive machines and threads and stuff, but they're very difficult to do anything with except for the surgeon to take out the extra skin. But we're not doing that today.
I don't want to do that.
No.
I'm not.
So what we're going to do is part of our Botox treatment today is we're going to give a little bit of a brow lift. And most people, I usually tell people, 3/4 of the people will like that. They will notice when they put their makeup on that it's improved. And 25% don't, but 3/4 do. So it's a little bit of Botox for that. So staying along with the Botox talk, we were going to relax a couple of areas to help keep the wrinkles away. Remember, Botox does double duty. 1, makes you look better today. Number 2, it's preventing the wrinkles from forming. Okay? So wherever we can do that.
Sounds good to me.
So make yourself real mad at me. Good. So we're going to do those things. Those are called the 11s. Relax for me. Yours are not that noticeable yet, but they would be the more years we don't do that. The forehead, we want to be very gentle, because if you take care of all the forehead lines, we would make our eye problem worse. We don't want to do that. And of course, then we're going to do the crows here. And it gets between my fingers, Again, her wrinkles and lines are not too much yet. But just like all of us, every year they get, this is going to stop that and make them look better. Okay? So that's kind of our Botox treatment. Next, we're going to move on to fillers. What are fillers? Fillers are the Juvederms, the Restylane, the RHAs. Fillers fill. Okay, it sounds simple, but that's what they do. A lot of people don't know the difference between Botox and fillers when they first come to see us. Botox relaxes a muscle, which makes the wrinkles better. Fillers are replacing.
Oh,
okay. So when we treat people, we have 2 choices, cut and pull or refill. Okay? And that all depends on the age, the person, what we're trying to do. So what we're going to do is, we notice there's a little heaviness here, a little bit of what we call these tear troughs, where people say they look tired, but usually there's a depression in there, okay?
Yeah, and there's how much contouring it takes me to get ready to hide this? A lot. And I'm kind of tired of it because I'm on camera just about every day. Yeah, I need that taken care of.
Exactly. We've been talking about that. So we tend to be orderly with what we're trying to address. So upper face, we talked about. So we're going to put a little filler out here to give her a little lift. Okay, a nice natural lift, because we tend to get more square and things come forward as we age. So we're going to put a little bit out here just to give a little bit of a cheek lift, which will then help here as well. And then we're going to put some in the tear troughs. Then we'll drop down to nasolabials and marionettes, because we want to soften those lines. And everybody, a little triangle here, a little overhang of Mr. Jowl, which nobody likes. We're going to try and soften that line right there. Okay? And then you mentioned something about lips. Tell me about your lips.
So my lips are they're not that small, but they're not, so what happens is, because I'm on camera all the time and he takes shots from far away, I feel like I have to sometimes use red lipstick to get them to really be visible, because it's that look now, everybody likes a full lip. And now that the older I get, and I feel like sometimes when you gain weight too, your lips appear to be smaller. So I do want a little bit of that pop, where I don't have to sit there and spend 15 minutes on my lips. I would just rather just get dressed and maybe put some lip gloss on, and they're nice and popped already.
So, as people may or may not know, you haven't had this stuff done before.
No.
So during consultations, when the people are getting it done the first time, they're very fearful. They're afraid they're going to look funny, because everybody sees the funny-looking people.
I don't want to look like a duck.
Right, exactly. And lips even more. So what I tell people with lips is, it's like inflating a tire. We decide the size, because size is somewhat personal. It's not the doctor saying, let's do this. It's often size is personal. Some people want it a little bit, some people want it a lot. So we kind of have that discussion. So we kind of dial it up. And as we talked about, before, we'll say we want it to be a little bit bigger when you leave today. And then, because there's a little swelling and it goes down. So that'll be one of our goals. You're going to check it with me while we're doing it for size, and as well as making sure they look even.
Okay.
So when you're checking it, I'm actually checking it too.
Okay. Wonderful.
All right?
Yeah.
And then, for the icing on the cake, we're going to do micro pen with Regeron. That'll be our last treatment. So micro pen is, we put some numbing cream on, tiny little holes go into the skin with our micro pen device over here. Tiny little holes go into the thing. And the little holes, the little injuries themselves, they stimulate collagen. This is everything for the skin texture. Fine lines, pores, because women will come and complain, my pores are getting bigger, I got little fine lines, so that's what this helps with. We're going to then use a regenerative product, which is part of the new stuff coming out. We hear about stem cells and PRP and exosomes, and this one's actually salmon DNA. Why do we use that? Because the DNA of the salmon and the humans is very, very, very close.
Wow. Okay.
So they just make a nice purified product with minimal risk, almost no risk, and that helps with hydration and further helps with all those changes, because it's DNA, it's regenerative product. That's a big buzzword in the aesthetic cosmetic space, regenerative products, the DNAs and all that, and stem cells. And that'll be our last thing that we do.
Wonderful. I'm ready, guys.
Okay?
You ready?
All right, super. We're going to get started. Next thing we're going to do is we'll put some numbing cream on, and then I'll do some paperwork.
Awesome. You got it.
We're going to do your Botox, simple little tiny injections, a little bit of them, should be fine. Okay? Little thing. So we're going to start with that, okay?
Yes.
All right, good. All right, good. All right, so I'm going to clean you, okay? So the Botox treatments are usually fast and pretty quick. They pinch just a little, nothing terrible. Botox will take about a week to work, so we're not going to see the Botox effect today. Takes about a week to work, and then full effect at about 7 to 10 days. Look up for me. Good. We're going to do those forehead lines. Make those up there for me. That's it. Now relax. Good. Now relax. There we go. Little pinches. Little pinches. And we're just doing a little bit on her forehead, as we talked about before. We just want to soften them. We can't make them go away, because then she would get too heavy on her eyes, which is one of the problems that we're doing. Good. We're going to between the eyes. Show everybody the 11s. Good. There, the 11s, the two lines. They call those the 11s. Now relax for me. Good. And we're injecting specific muscles to relax specific muscles so that they do what we want them to do, which is to relax. It'll last 3 to 4 months, and then the body will reverse the effects. Good. She has her squeezy ball under there?
She does.
Super. Show them the squeezy ball. All the things we do to help people stay comfortable. Doing okay? Mm-hmm. Good. Good. Alrighty. I'll do crow's brow lift, brow lift, crows on each side, okay? We have numbing cream here. It's going to get in your eye. That got up there. Good. Okay. I'll take another gauze. Alright. Alright, big smile. Good. Relax for me. There's always little blood vessels out here by here. We try to avoid them. And this is for the crow's feet. Good. And now we're going to do the brow lift. We're going to do right here, okay? Mm-hmm. Okay. Little pinch. Little pinch. Good. Kelly's going to switch sides. Good. And she's going to hold the crows extra for me because they tend to bruise, so we hold them. And then we're going to do the other brow lift, the other side. We inject near the eyebrow. Good. When every time we're breaking the skin, we're always trying to be extra clean. Infections are very uncommon. With Botox, they're almost unheard of. With filler, they can happen, but they're still very uncommon. Okay, big smile. Relax for me. Good. Good. Does that look good?
Yep.
Good. How we doing?
Great.
Take a little relax on the ball. Take a little relax. There you go. People tense up, so periodically I'll be telling them just take a deep breath. Take a deep breath. And then we have to do bunny lines. Okay. Good. All right, squint your nose. Okay. Little pinch. Now relax it. Now relax it. Good. Super duper. Come hold this crow's for me. Good. Alrighty, good. Because even this one's still leaking. If you look here.
Yeah, it just popped out again.
I'm saying, yeah. So that's why we want to watch them as long as we can. All right, squint your nose. Good, relax. So we always have lots of our slang names. The 11s, the bunny lines, the crow's feet. You know, they all have fancy names. The fancy muscles that we're relaxing. Good, 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 good. So that was our Botox, quick and easy. As I said, the follow-up for Botox itself, nothing special. There's some old rules out there that people will tell you the things you're supposed to do, moving muscles, but they're kind of all outdated. So really nothing special. And I always tell my patients to look at that Botox in a long week, make sure they're happy, especially for the forehead. And then Angie's also going to see how we did with the brow lift. She's going to kind of pay attention, you know, in a week when she's putting on her makeup and stuff and seeing if it's better. So next, we're going to move on to fillers. As we talked about before, fillers fill. They replace some of the stuff that we naturally lose. As we age, they finally looked at it scientifically, we lose bone, muscle, and fat. That's what, you know, everybody thinks our skin just gets loose. Actually, we're losing the natural support structures. So that's why when we refill with a filler, we're kind of putting some of the natural support structures that we're going to do, you know, for that. Alrighty, good. Alright, super duper. Okay. There are lots of different, I'll wait till we're ready. Now, filler is a little bit more pinchy, a little bit more, okay? Mm-hmm. For you. It's just a little bit more, okay? Alrighty. You feeling me? Want me to talk? Mm-hmm. Good. All right. So for filler, we're starting with a good cleaning. Infection's very uncommon, but we still want to have our aseptic techniques down for all that. We're going to start with the upper face, a little bit of a lateral zygoma lift, lateral cheek lift. Lots of people that know about fillers, they know about the cheek lift. Then we're going to do the tear trough. So we're going to work on this complex in here. By lifting here, it's going to help the nasolabial. So people that, what we talk about, the cheek lift, for that. We have the tear troughs, we have the nasal labials, we have the marionettes. These are all things we talked about. Okay? Good. No. No, we're starting with a voluma with a needle. Alrighty, so we're going to do our voluma first. So when we talk about the types of fillers, Juvederm, Restylane, RHA are families, and then you have their children's names, Voluma, Ultra, Ultra Plus, Volux. Don't worry too much about that, about which filler, because your provider will guide you, because there's many choices. So we're going to start out here. You can use cannula or needle. We're going to do the needle out here, because it's a little bit easier for this area right here. For that. Okay, I'm going to sit you up a little bit, because I'm just double checking something. Good. Most of my patients, 9 out of 10, they have a little bit more of a deficit on the left side. Not as noticeable with Angie, just a little bit. Okay, let's go back. Good. All right, I'm going to tilt you this way. Good. All right, Kelly's putting Mr. Buzzy on you. Mr. Buzzy helps to block the pain. All right, then we're going to put some filler out in here. Okay, first pinch. So this is a lifting that we're doing, lifting the cheeks. So it tends to be a little bit of a deeper injection for all that. And again, we want to give her some shape on the side and raise these. It doesn't raise the marionettes as much. Good. All right, and as I check this, I'll sit you up because it's a more natural way for me to look. How are you doing, okay? Mm-hmm. You sure? Mm-hmm. All right, you're in the zone there. Okay, go ahead back for me. Good. I'm going to tilt you a little bit. Good. Kelly's got Mr. Buzzy. Mm-hmm. Good. So for reference, these syringes are 1 cc, so it takes 5 of these to make a little teaspoon. So people, when you talk about syringes and stuff. And one more here. Good. We're doing good. Alrighty. Clean that cheek for me again while I hold. Good. Take some nice deep breaths. No needles. Good. Good. All the way out, all the way up. Big areas, big areas, big areas. Good. 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 We're switching sides. Good. Alrighty. Super duper. Alrighty. I'm going to do the same thing on this side. We okay? Mm-hmm. Good. I'm just going to move you this way. There we go.
I like Mr. Buddy.
Mr. Buzzy, yep.
Buzzy, yeah.
Mr. Buzzy. Doctors like to study things, and they found out that Mr. Buzzy is more effective than the numbing cream. Mm-hmm. So having them both is even better. Right, keep an eye on things for me there. Needles are very tiny.
Where's Mr. Buzzy?
So they tend to get dull, so we tend to...
I like them on my nose, that felt good.
We tend to change them out as we work. All right, good. I'm going to do chin up a little. Good, there we go. All right. Okay, keep an eye on our leaking. All right, let me sit you up, hon. Good. All right, I'm just going to turn you a little bit. Good. Good. As you and I talked about, we have that little swelling on the under here. Mm-hmm. Those little from the festoon that we have to keep an eye on that we don't aggravate that. Okay. Good. Okay. Good. Go ahead back for me. Hold pressure there, Kelly. So we try and get things symmetrical, even though the body is not symmetrical. Even though the body is not symmetrical on each side, we're trying to make it closer. So we tend to use a little bit more fill on the left side versus the right for most people. But I'm periodically reassessing that. All right, let me sit you up a little bit. Mm-hmm. Good. All right, I'm just going to tilt you a little bit. Tilt you a little bit. Okay, good. Go ahead back for me. Mm-hmm. Good. Go back this way a little bit. We're looking good. I'm almost done back here. I got a little leaky spot here. I need to come put a finger on. Switch sides with me. Good. This spot right here.
Got it.
Can you see it?
Yep.
Okay. That's swelling. It's not filler. Okay?
Yep.
Yep. All right. Okie dokie. We're gonna go this way, hon? Good. I'm gonna track down here, okay? Track down those nasal labials and marionettes, so we're working on next. We save the lips for last.
One more time, Doc.
Okay, no problem. All right, so we did our cheek lift. I'm gonna do some nasal labials and marionettes. Then I'll get back up to the tear troughs and I'll get back to the lips. We're doing a lot of areas today, which is good. We're doing a nice refresh without doing too much. And part of the reason that we're addressing these areas is because we haven't done them before. So we have a lot of areas where we're just putting a little bit to touch up a lot of little areas as we talk about the refresh. Good. I'm coming right here, hon, okay? Good. Little pinches. And these are nasal labial folds. This is one of the first areas they were doing fillers in. Everybody should have them. They're kind of natural. We just try to keep them from not being as deep. Okay, I'm coming down here, hon. This is another bruise area, just more blood vessels. All right, good. Switch sides with me.
Want the ice stick?
Whatever you want to do, just switch sides for me because I need pressure over here. Yeah, because I need pressure. Ice stick after we stop any stuff. Good. That spot looks okay now. Okay, hon, I'm right here. Again, everything we do with filler, our goal is to look natural, refreshed, younger. Some people will take pictures of themselves 15 years ago, and that's kind of your goal sometimes. Down here. All right, little break. All right, how are we doing over there? How's that leaking? Good. Give me another gauze. If it's not leaking, give me the ice stick. Give me the ice stick. All right, good. Load me in one of the ultras. All right? We can move the two volumas off, and then I'll have an ultra and a Restylane there, okay?
Yeah.
Doing okay? Good. Good. You can peek as we're going. You can peek. So what we've done is lift these guys, and now I'm about to put a little bit more into these guys here. All right. Left, we'll do these guys, and then the lips. After I finish touching up these at the bottom.
Okay.
All right. Switch that out for me. Good.
Thank you.
Yep, it's good. Progress is good. Progress is good. I'll stick that right on your leg. Okay. Good. All right, good. Okay, good. I'm going this way. Good. Go back down the marionettes here. Good. Switch sides with me. And hold this. Good. All right. Let me sit you up, hon. Okay?
Okay.
Come on up. Good. Yeah, I'm just checking. Good. Big smile. Good. Let it relax. Good. Yeah. Sometimes it looks perfect when I'm having laying down. That side looks really nice. Good. Let's get a little more on this side. Good. Hold pressure on there for me, Kelly. Good. Good. Chin up a little bit. There we go. Gonna do a little more right here. All right. Good. All right. Take that. Just put that on hold, okay? Good. So we're going to do the tear troughs next, okay? So with the tear troughs, it's a little bit of a different technique. I'm going to give you a little shot of lidocaine here because I do it through one hole, okay? So through one hole, then I slide this cannula device and I just keep dropping it where I want to drop it. So it's a little bit of a different feeling, okay? A little bit different feeling, absolutely. Good. Good. Keep an eye on your side while we're doing that. So we talked about her cheeks where she's got the blood vessels here. Some people would call that rosacea, but everybody gets the red cheeks out here to some degree. And the treatment for that is very commonly called IPL, intense pulse light. IPL. It's a little notch down from a laser. And the med spot also has another name called a photofacial because it's shots of light. Very effective for reds and browns. So when you have these blood vessels, which women often cover up with their makeup, so sometimes I don't know they're there, so we take it off, but it's very effective for those. In fact, I just had it done on myself one Friday because I got a couple of veins I didn't like. Alrighty. Okay, so we're gonna start working up here, hon, okay? Good. Good. You need a stretch? Need anything? Sip of water? Need anything?
I'm good.
Okay, good. All right, good. Okay, we're doing a lot. We're doing a lot. Okay, so here comes that little bee sting pinch, okay? Bee sting pinch. So what we're going to witness now is the cannula technique. Why? Number one, anything under the eye, there's more blood vessels. So it's a safety thing. Number two, you bruise a whole lot less when you work up under here. You can do this with needle, but you bruise, it looks like you were in a bar fight when you do it with the needle. Good. And we're using Restylane, which is one of my favorites for the under the eyes. And we use Voluma for the lift. And we're using that. Okay, a little pinchy as I move myself around, okay? A little pinchy as I move myself around, okay? You'll feel me come right up where we need to be. Good. Right up into those tear troughs. And this is a very delicate area. Very tough to do a good job in. So when you're getting your tear troughs done, you really want to make sure that the person has a lot of experience in this area. And it's one of the areas you don't want to overdo. So I always tell my patients I'm trying to get it 80% better. When you go for perfection, you end up with too much. It just doesn't look good. And we often will do it in 2 stages, again, to prevent overloading. So when you're taking care, well, you probably won't even see this little hole once we do the micro pen. Good. So you're going to feel me just moving around this way, okay? Here we go. Little pinch as I come up into the spot. And I'm putting very small amounts in there. Good. Let me sit you up. Good. Good. Just seeing how we're doing getting that filled. Good. Okay, go ahead back for me. Good. Good. All right. Good. Doing okay? Good. Take a little relaxation, a little deep breath. I'm going to switch sides. Everybody's saying sorry. It sounds like my pickleball game yesterday. Every time one of us messes up. All righty. Good. Good. All righty.
You're doing great, baby. Doing great.
All right, I'm coming this way, hon, okay? Good. Relax your smile for me, good. I'm starting with that little bee sting thing again. Little pinchy pinch. We call this the pilot hole. So we're going to do everything through that little hole. Because of your rosacea and all those blood vessels there, tends to just bleed a little more. When I say bleed, it's always a couple drops. Okay. Is there anything we need to hold on that side? Okay, good. If you need to hold it, you need to keep holding it, just tell me. Okay, I'm just sliding up into our tear trough here. Good. Sorry, hon, a little pinchy. Doing good though.
Doing great.
Yeah. All right, we're going to check everything. Are we done leaking? Are we leaking?
No, we're good.
All right, good.
Yep.
Let's check the tear troughs together. Good. Grab your mirror down here. There you go. Good. Let me see how we're doing. Good. All right, so I'm going to get a little more there. Okay. And same on this spot. This one needs more. Okay. You see we're closing it in, how this one is not as noticeable. This one's still not as good. That we're trying to do. Okay. But again, we don't shoot for perfection.
Right.
You know, we just want to make them better.
Okay.
Okay. There you go. All right, good. ahead, switch sides with me. All right, hon. I'm getting a little bit more up here, okay? Good. Telling you. There we go. Okay. We're doing good. Keep an eye out for leaking. Doing okay? Mm-hmm. Good. All righty. Good. Again. All right, so why do we save lips for last? Because lips are a little bit pinchier, okay? They're a little bit pinchier. A little bit pinchier. So when we look at the aesthetic for the lip, we look at how much we want to pout. We always have to have the top and bottom. The bottom always has to be slightly bigger or the same as the top, or they get out of balance. So people come and say, I just need my top. We always end up doing a little bit in both, you know, because it's all about symmetry for that. And as we talked about, our goal today is that we're about 10% bigger than she wants when she looks at them, because then in a week they look perfect, okay? Everybody says, don't make my lips too big the first time, then they come back in a week and say, oh, make them bigger. Okay. All right, here we go. Mr. Buzzy, good. Okay, little pinch. And we use Restylane Kiss. Kiss is a little bit of a more pliable filler. Gives them a little bit more of a natural look. Good. Relax your jaw for me because I'm going lower. Thank you. Okay, little break. All right, hon, chin up for me a little bit. There we go. All right, I'm lower right now. Okay, a little break. Hold pressure, please. Recovery for your fillers. You want to just don't touch it. Don't exercise today and tomorrow. And I'm going to tell you to sleep up on an extra pillow. So rest, a little bit of coolness. You can put the ice where you think you need it. You know, if it's not sore, focus here. If you're not sore, don't touch, don't massage, don't do anything. All right, good. Switch sides on me. All righty, good. Okay. All right, as soon as I stop your leaking here, I'll have you check, okay? So we did about 40% of the syringe. So the first time we'll somewhere do between 50% and 100% depending on our size goals, okay? And while you're checking it, I'm also checking it too. I'm checking it to make sure it's symmetrical and stuff. Good? Good. Let me sit you up. Sit you up. Good. Make a big smile and then let it relax. Good. Good. Yeah, because we're not quite symmetrical yet.
Yeah.
Yep.
Right here.
Yeah, we're not quite symmetrical. I need some in the middle here.
Yeah.
Yep, no more over there. Yep. Good. I shouldn't have showed it to you. I should have checked it first. Let me go down here a little bit. Good. Just relax for me. Good. Good. Usually I'm going to make it a little closer before I'm going to show you. And if we're not sure about size, then I'll have you, we can add to it when I bring you back in 2 weeks. That's a common thing I'll do for people. Do a little tweaking after it settles. We'll do a little tweaking with some of our, so we have little bits left over. Good. All right, let me sit you up. I'm gonna look first, big smile. Good, let it relax. Good. Good, go ahead back. Good. Okay, I'm going to do a little smooth. A little smooth. Good. Good. Let's take a look together. Take a look together. Good. Good. Open and close for me. Good. This spot's a little puffier for some reason. You know, the bottom open for me though. Good. Yeah, I'll get a little more pop in there on the bottom, just so it matches that pop. Good. I think some of this is swelling. I didn't really put that much in there. Good. How do we think about the top?
I think you use a little more now.
Yep. Yep. Yeah. I think we got the left side back up, so I'm going to put it in even. Okay?
Okay.
All right, good.
You know, I expected a lot more bleeding. I'm impressed. This is live.
All right, I'll do some smoothing, and we'll check. Good. Okay, just relax for me a little bit, okay? Good. Stop the leaking. We're getting close. All right, let's take a look together. Okay? Mm-hmm. Good. Good, big smile. Good. Come on up. Good.
Looks good.
Yeah. Mm-hmm. It's slightly low in the middle because there's a compartment here and a compartment here. Mm-hmm. It's not all connected. So it's slightly low in there. That'll fill out. If not, when you come back, I'll put another drop or two in there.
I think it looks good.
Yeah. In fact, we'll do another drop in two in there, and then we'll leave and go. Okay?
Okay.
All right?
Thank you.
Good. Yep. Good. Head back. I'm just going to get a little drop just in that low spot that. Okay. Good. That's you. Good. All right. All right. Kelly, can I have the ice stick? Mm-hmm. Good. All right, good. Relax that hand. I'm going to give you an ice stick. Good. All right, good. And I'm going to show you the spots, okay? Mm-hmm. 1, mm-hmm. 2, mm-hmm. 3. Okay?
Okay.
Sorry. 1, 2. These two on each side. Just cool yourself down a little bit, okay? Mm-hmm. And then we're going to use the regenerative product Regeron. Regeron is salmon DNA. So our goal with all this is pores will be smaller, fine lines will be smaller, and it's going to work on skin quality for moisturizing, plumping, glowing. That's our goal for all of this. Good. Yeah, no, take that away. Take that away, yep. All right, where are you going? Okay, I'm going to point where I want it. Okay, I'm going to point where I want it, okay? Good. And we'll start at 1 millimeter. Good. So make sure we work on the crow's fine lines here, a little bit extra. Okay. You doing okay? Mm-hmm. Good, I'm going to do your nose a little bit, okay? Mm-hmm. Good. Good size, Tammy. Good. You okay? Mm-hmm. Good. Under the side here. Okay. Take a little deep breath. Good. And I'll bump this up to the 1.5. Good. Okay, how much you got in there?
1.
Good. All right, so Kelly, when you take over the syringe, all right, you just have to make sure it's enough for the last 0.5. When we're all done, that goes on as the mask. And then she dries, okay? After she dries, then the moisturizer goes on after she dries, okay? Good, come switch jobs. Good, come switch jobs. I guess I'll stay in the back. I'll pretend like I know what I'm doing.
Oh, I was gonna let you out.
All right, you see what you're doing?
Yeah.
All right. Yeah. There you go. See him? Mm-hmm. Good. Can you see where the 0.5 is? Okay, good. Yeah, good. Good. Get some good stuff on there, Tammy. Show her where you want it.
I just did it now, so I'll be okay.
Oh, you did? Okay.
But right now, I'll just do it
Gotcha.
now.
Good. So as we're doing this, we're trying to make a conscious effort to get 3 passes. Up here, we can't change directions, but on the face, we can. we go. Good. This stuff is good. It doesn't run off. Good.
Getting close.
Okay, because we have this whole side of the cheek then over here too.
Okay.
All right. That's why you need to follow it so it doesn't run out.
Okay.
Good, we're doing great.
You get from here. Just a little travel. Okay. Okay.
And then that's where we have our other lubricating one too. So which one goes on, the rescue or the lubricating one when we're done?
Lift goes first.
No, when we're done.
Yeah.
Lift when we're done?
Yep.
Okay.
This is when she goes home mask. So at first she'll just do the mask in the blue package. Then she'll use the lift first for today and the cover for day 2 and 3.
All right. Go over those instructions on the sheet, okay, before I come back in.
Okay.
Just to make sure it says all that.
Okay. You're looking pretty good in the beer.
Yeah.
You got all your surfaces.
Yeah. I can double check to see if she's white anywhere. Sure. Yeah. Check the other side for me real quick there. There you go, you got it. Good. Alrighty, so we finished up our nice session today. Doing some rejuvenation, as we talked about earlier in the video. We did our Botox and we did our filler, and we ended with our micro pen with Regeron. So she's slightly red. That'll fade very quickly. She has a little. We went over the post-op instructions. For the Regeron micro pen, she has some products to use, and she has a nice cooling, soothing mask to use at home. Okay.
Yes, everything went great. Thank you so much. I really appreciate everything you guys did for me. Your staff is wonderful and you're fabulous. Thank you. Welcome to Film, Food, and Fashion on My Passion podcast. This is the second half of it. My name is Angelique Inakos. I'm your host. And today we are at Young Medical Spa in Lansdale, PA. And as you can see from the first part of the video, I just had a few things done. We had the Botox done here, and we had some fillers in here, and I had lip injections done. And then lastly, we did the microneedling. So I just completed everything literally moments ago, guys. And I want to say that it was very, very comfortable. It was a lot less painful than I thought it would be. They numb you up really well. The staff here is wonderful. They give you like a little squeezy ball here if you need it. And if you need to stop at any time, he's just really, really accommodating. I want to say feel a little bit of burning sensation, almost like a sunburn, like, a really nice sunburn. And but nothing painful. As you can see, I'm talking. I've been numbed up. I just feel really, really good. So if you guys had any concerns or questions about anything that they do here, please give them a call. Their number is 215-362-7546. It's a Young Medical Spa in Lansdale, PA, and they do have 3 locations. You can look them up. They also do anything from smart lipo, cool sculpting, threads. They do the Morpheus. They do just about everything you guys need. So I'm turning 50 next month, guys, so I've wanted a little pick-me-up, and I definitely got it. So check in back with us with the Philly Food Fanatic, because you all know I'm on there just about every other day, and you'll see the results. It takes about a week to really kick in. Okay, so thank you for joining us today. I want to thank the Philly Food Fanatic for always sponsoring this podcast. And obviously today we were sponsored also by Young Medical Spa, and Dr. Young did a great job. So thank you very much to the staff and everybody here, and check them out. Thank you.